Hi, I'm medical oncologist Dr. Grace Sa. Thank you for joining me today. We're on the campus of LivingWell again, and today I thought we would talk about an important topic that comes up very frequently in our clinics. It's on probiotics, or biotics in general. Thank you also for tuning in to our last talk on vitamin D and coffee and colon cancer. I really appreciate the responses and the positive feedback. So I thought today we'd go into some of the basics and talk about what probiotics are, how we figured out that it's important, and what we can do to improve our overall health. So when I told one of my patients that I'm going to be talking about probiotics today, his very astute wife said, well, isn't that just a yes or no answer? Probiotics are good, or yes or no? And I thought, yeah, it kind of is a yes and no answer. So if you're on a timeline and you're busy, you got the gist. Probiotics are good. But like many things in life, it's very nuanced, and there are pros and cons always. And I'm going to give a very definitive answer. It depends. So they say a way to a man's heart is through his stomach. So it turns out a way to one's immune system may be through the gut. And that may be by the interplay between the bacteria that colonize our colon and the way that our body functions or has an immune response to them. The human body, as we know, is teeming with organisms, some 40 trillion with a T. The vast majority of these bacteria live in the colon. There's some in the skin and mucous membranes, but the vast majority, approximately 1,000 species, live in the colon. Some are good, some are bad, and of course, some can be both. And the way that our body functions and interacts with this bacteria can have a very important role and may be fundamental to our survival. An example of a bad bacteria, for example, that we thought was bad was H. pylori. You may know that a scientist actually drank H. pylori to give himself gastric ulcers and prove that the bacteria can cause disease in humans. And we know that H. pylori can be linked to gastric cancer as well. But in 2008, scientists looked at certain strains of H. pylori that actually, if they're present, can reduce the incidence of esophageal cancer. Now, how could that be? So there were a lot of questions that were raised. And these observations are not new. Over 200 years ago, physicians noticed that patients who had tumors, if they had a certain kind of soft tissue infection, these tumors got smaller. So the patients had an infection, but their tumors shrank without any treatment. Now, unfortunately, that was before the discovery of penicillin, so these patients succumbed to their infections. However, this observation was noted by physicians for hundreds of years. More recently, we have utilized a certain kind of bacteria that are akin to tuberculosis bacteria, and we use it to induce an immune response to a certain type of bladder cancer. So even today, we're using certain types of bacteria to help harness the immune system. This became very relevant to us when we recognized that a type of immunotherapy or immune checkpoint inhibitors, such as ipilimumab or Yervoy, have extended survival in patients with melanoma, metastatic melanoma. Now, that was the first proof of concept in this tumor type. We now use immunotherapy and ipilimumab or Yervoy in multiple types of different cancers, such as colon cancer, lung cancer, kidney cancer, and the list keeps going. These immunotherapies harness or release the immune system's brakes on the T cells. And the T cells are white blood cells that attack harmful pathogens in the body. And we can look at cancer cells as kind of bad cells and harmful to us. So the immune system can have a break where these T cells are not able to be activated, but the new immunotherapies unleash the brake And so now our own immune system can go and scavenge these bad cells. Now, how could gut bacteria have anything to do with this mechanism? How could bacteria in the colon have anything to do with reaching the immune system and the T helper cells, or T cells? A few years ago, there were a few studies that looked specifically at this mechanism. Now, you're going to see very quickly why I'm a doctor and not an artist, but I thought it would be helpful to have a drawing because there's it's a really interesting story. This is where the story comes in. So scientists were investigating where this immunotherapy called ipilimumab has an effect on melanoma. And in early studies, we looked at what happens if you have a mouse that's completely germ-free. So this mouse has no bacteria in the colon. And so this mouse, that's my fancy mouse. So this mouse now has a tumor and it's germ-free. So when we treated these mice with that immunotherapy drug, called Yervoy, we were able to show, these scientists were able to show that there was no response. So these melanoma tumors just kept growing. Now, similarly, what they did was they took regular mice with regular colon bacterial colony, and again, you see the tumor, and we gave Yervoy, but this time we wiped out the bacteria in the gut with antibiotics, and no response. So no response was seen in these bacteria, or in these mice, kind of insinuating that the bacteria had something to do with the response of the immunotherapy. So these scientists went further and looked at humans. Okay, what happens if we take a look at patients who have melanoma and they're treated with this Yervoy, and you're going to have some patients who respond and some who don't. So we give these patients with melanoma, we give same ipilimumab. There are going to be some that have a response to the drug, and then some who don't. And then we take the stool specimen and give it to the mice who are germ-free. So now these mice are going to get the stool, the bacteria from the responders of the patients with melanoma. They had a good response to immunotherapy. We give it back to the germ-free mice, and now they have a tumor. What happens at that time? Well, these mice, these mice actually now had a response. So we were able to regain that responsiveness, just by altering the bacterial mix in the colon. Another study that was done locally in Chicago looked at 42 patients undergoing therapy for metastatic melanoma. And of these 42 patients who were going through therapy, they were all given immunotherapy. So no chemotherapy, but these treatments just unleashing the immune system. And we looked at the stool specimens of all 42. Now, scientists postulated that there would be some effect from the colon, from the bacteria. They postulated, they guessed that these patients will, if they have good bacteria, there may be some association. However, what was really surprising was that out of the 42 patients, the patients who had a response and no response, they looked at the DNA and the composition of the stools, and there were 8 commonly seen bacterial species in the responders, and 2 that we're seeing in the non-responders. So we divided these patients into the responders and non-responders and looked at the stools. There were 8 bacteria that were very common in these responders, and then there were 2 that, like, if you had this, not likely to respond to immunotherapy. And then they did another experiment and again transfer them to these little mice. My mice look terrible. Okay, so these are germ-free mice. So these mice with like no germs. And when they gave the 2 groups same germ-free. So they took the stool samples from the responders and non-responders and put them into like 2 different sets of mice. And what they saw was that the ones that got the kind of the 8 good bacteria mix, when they injected tumors, like injecting, we implant tumors, which is something I used to do when I was in the lab. We implant tumors into the mice and observed the growth of these tumors. Just by having a different mix of bacteria in the colon, it slowed down the rate of growth of the tumor. So no therapy at all, but just the composition of the bacteria in the colon helped to reduce the rate of growth of the tumor itself. And then the ones that had these 2 commonly seen bacteria species in like the non-responders, those tumors grew rapidly, much faster than the control group. So now the investigators took these species, took them to these same mice, and they treated them with Yervoy, which is the immunotherapy they were looking at the time. So these mice now got injections of Yervoy. This group that had the good responder stool specimens injected into them, these tumors grew slower, and the Yervoy was able to, in some cases, completely wipe out the tumor. Whereas in this group, where the mice got sort of the commonly seen bacteria in the non-responder group, when they had injection of the tumor, it grew rapidly, and Yervoy had no effect. So we were able to replicate kind of what happens in humans by using these germ-free mice and injections of Yervoy and immunotherapy. So what does this mean? Now, the bacteria that scientists looked at, there are a whole bunch of them, and they're all a mouthful. It's like Bifidobacteria, Bacteroides fragilis, Clostridium. They're just really, they have really long names, and there are many of them. But the conclusion, based on this association, was that microbiota are not just they don't just play a supportive role, but they actually play a major role. And they're sort of the gatekeeper to our immune system. And having a good mix of these bacteria, having that kind of secret mix of bacteria in the colon, can help our bodies boost the immune system, help to fight tumor, and help the immunotherapy, our treatments work better. Now, just how exactly they're doing that, there are a lot of very smart scientists all over the world looking at this question. We don't quite know yet. It's still not completely understood. And whether these effects are driven by the bacteria having local effects in the products that these bacteria are making in the gut and is being absorbed into the body, or it's an interaction between our innate immune system and the bacteria itself, something that triggers the immune system, we're not quite sure yet. But it is an area of active investigation. A lot of clinical trials and work in the lab is being done today. So what's the bottom line? I think probiotics are good. to answer my patient's wife's question. But the nuance is that for cancer patients, some patients are undergoing treatments that are immunosuppressive, that can put them at risk for certain types of infection. And the old adage, too much of a good thing, may apply to them. In general, supplements will not be harmful. However, again, I am concerned about too much of a good thing. And we don't have enough information to date to recommend a certain type of probiotic one over the other. And as these supplements are not yet FDA approved or regulated, we don't really know what you're getting. However, when we take food probiotics through our food sources, I think that's the safest way to get our probiotics. And what foods contain probiotics? So things they used to use fermentation as a way to preserve food in the olden days. So anything that's sort of like preserved or fermented in that way, or use fermentation as a preservative, is very helpful. Examples are yogurt, kefir, kombucha, which is fermented tea. Something that's near and dear to my heart is my mother's kimchi. And pickles. Now, what does not contain probiotics are beer and wine. They do not have any. And things that help to boost the probiotic flora in your gut are green leafy vegetables, which contain compounds that may help the growth of probiotics or promote their growth. And that's a short list, but you can find probiotics that have different textures, that are sour, tart, sweet, sticky. So hopefully you can find one that suits you and incorporate that into your diet. Thank you very much for your attention.
Question for you.
Yes.
And hopefully people just keep questions coming in, but are prebiotics the same as probiotics?
That's a good question. Yeah, I'd love to delve into that a little more. That's an emerging area of research. Prebiotics are not the same as probiotics. They do not contain bacterial compounds, but they kind of help or support probiotics. So, for example, I mentioned green leafy vegetables. Those contain compounds, not just the fiber, but compounds that help promote the growth and growth of the probiotic, the good bacteria. So they're not the same, but having a good kind of milieu can help the probiotics do their job.
Another question, supplements. So I know you touched on those. Is there a reputable source? Like, what do you look for to make sure that you're getting a good supplement if you want to go with supplements?
Yeah, that's a tough question. Now, for fun, I browse all the groceries to see what's new in the supplement aisle, and I look at the foods and read the labels to see what probiotics are contained. It's difficult to answer that for a number of reasons. One, dosing varies greatly between supplement to supplement. And just because the bacteria that was studied in these scientific papers was beneficial for that group does not mean that it will work for every person. So, until we have some way to regulate and understand what is exactly in the supplement, and also to have more data to help us guide patients, I can't recommend one brand over the other. But that is not the case for food sources. That I think having a variety makes the most sense in that case.
Another question just came in. I love yogurt, but gently freeze it. Does that harm the live cultures by freezing?
No, it should not. It should not, as long as, because what we see is that when you freeze it and thaw it, it still will ferment. So as long as these cultures come back, I think I don't think that there'll be harm.
Question is, what is kimchi?
Oh, kimchi. You and I need to go out to dinner. So I'm Korean, but it's fermented cabbage. or any other like vegetable, really. It was a way to preserve vegetables during the winter time, I think. But it's a fermented cabbage product. And you see that in different cultures. There's fermented products, pickles, sauerkraut is one example. Pickles in various cultures. So, that sour taste is kind of a product of fermentation, and they're good bacteria, and they're doing their job.
I think maybe if you know what, just to add on to that, kombucha. And I don't know if I'm pronouncing it right, but is that something that's very similar, or?
Yeah. So I love kombucha. I actually make it at home. Kombucha is fermented tea, and the fermentation is similar, but it doesn't contain any like vegetable or real food in there. It's tea, and then you add sugar to help to kick off the fermentation process, and then it ferments over time. It's a drink.
I think that is the end of all of our questions.
All right. Well, thank you so much for joining me today.